the community that works front line. We want to support this. We salute this. Hey.
Hi.
How you doing?
I am fine. Thank you for.
Indeed. Can you hear me?
Yes,
Definitely.
I can hear you.
Me?
Yes.
Definitely. I appreciate you definitely for being here. It's a conversation. I'm glad to see you smiling too, because it's a serious conversation, but you smiling.
Yeah.
On the front line, it tells us that we can smile and we can feel good, and it's brighter days ahead. So
there's light at the end of the tunnel. Right.
It is. I'm glad to hear that. Let the people know your name and where you're from.
So I'm Pheona Grant. I am from Brooklyn, New York. I live in Canarsie. I work as a center operations director in an urgent care in New Jersey, where we do urgent care and we also do employment testing and things like that. So we are currently testing people to go back to work for clearance.
Okay.
And nurses, in the beginning, we were testing a lot of our employees to make sure they were safe and things like that. But due to the PPE shortage, couldn't.
Okay. You kind of you going in. You going in and out a little bit. I'm sorry, I don't know if everybody can hear you or I was just breaking up a little bit. Yeah, so I'm not sure if that was just me.
Hold on, let me check my Wi-Fi connection. Okay, is that better?
Yes.
Okay.
What part of Jersey? Somebody asked, and before we start, I want to let everybody know it's kind of one of the first times we're going to get into a real interactive. So if anybody has questions, there's a little question box down below. It's my first time kind of working it out, so you can shoot some questions through and we see what's going on. Somebody asked what part of Jersey you're in, though.
I'm working in Jersey City. So
okay, right
close to home.
Side of the water. Definitely,
right.
Definitely. How has your staff been? How's everybody spirit-wise and health-wise?
So in the beginning, staff were scared. They didn't want to come to work. I want to say out of 6 nurses, 5 of them stayed home for 14 days, and 3 of them tested positive for COVID.
Wow. So pull back a little bit. So the ones that stayed home for the 14 days, was that just a precaution or were they already exposed? Like, what was their deal?
They stay home for precaution reasons. And of the 5 that stayed home, only 2 of them tested negative. So the way how my company did it, if you chose to stay home for the 14 days, they were testing you to make sure that you were, negative or positive.
Yeah.
And we would test them. And if they came back negative, they gave them the choice to stay home for the 14 days to quarantine if they wanted to.
Copy.
And then those that tested positive, of course, you have to stay home. But it's kind of tricky when you test positive. Because if you wait for when you get symptoms to then say, oh man, I got to test, it means that you were already shedding the virus for about 5 to 6 days. So everyone around you was already exposed before you even knew you were sick.
Okay. For everybody that's just checking in, we're talking with a young lady. She's in the front lines and she has a lot of information and just firsthand experience, and we just picking her brain. So if you have any questions, let us know. By no means is she like an official spokesperson for anybody. It's just somebody I feel like we could come to from the community and talk to firsthand.
Right. Yes. I am not a nurse or a doctor. I do have a public health degree. I have access to a lot of websites due to my membership with the Public Health Administration. And plus, we work with infectious disease doctors through my company because they want to make sure that they are telling everyone the right thing.
Factuals. So what's your background? A little bit more about your background. You said you have a degree in what?
I have a bachelor's degree in public health administration, and I have an associate's in liberal arts. I've worked in the medical field now 16 years. The first 14 years, I was working with people with developmental disabilities. And then I took a break for about 2 years and started working in animal medicine.
Wow. Wow.
And then I recently left there and came back into human medicine.
Got you. We're gonna get back to
So
that. We're gonna get back to that towards the end in a second. But so is there anything right now that's like in the works for like nurses and people that's on the front line, maybe for a raise, or like is there a petition we can sign or a stimulus that's going around?
Here's the funny thing. So some hospitals are coordinating bonuses. I know right now, my sister works for Northwell Health, and she works in their accounting department. Believe it or not, it's in Georgia, and they're working on giving their doctors and nurses bonuses right now. Now, here's the funny thing, though. A lot of these hospitals and stuff that are wonderfully giving bonuses have also cut salaries and furloughed people. So it's like a catch-22. I actually had to furlough one of my nurses today.
But furlough, aka laid off.
Right.
Right. But
right.
So is that because of lack of what? Money, patience, supply, demand?
It's basically lack of patience. So here's the thing. When an urgent care patient calls, they're calling to find out, are you testing people for COVID? Because if you're testing people, I'm not coming. I don't live in the same room with people with COVID.
Gotcha.
So they're not coming in to do anything.
Because they pretty much think that the building got the cooties or they're going to come through.
Right.
Pretty much.
Right.
Okay.
Right. Because when you don't understand something, fear takes over.
Right. So now, you're about to get into the steps people should take. But I kind of want to start from the top, right? Because people, I know I could be wrong too. So I'm talking as people. When I say people say, I'm part of people. When I say people say or people, I have these questions too, right? So I kind of feel like it's like a flu. They keep saying it's like a high-grade flu, right? So explain to us how viruses are passed, even the flu. Just the basic layout of that.
So the flu virus, any virus, it depends on what part of the body it's attacking. So the COVID virus, which is known as SARS-CoV-2, right? This is another version of SARS, which is severe acute respiratory syndrome coronavirus 2.
Wait, SARS, like SARS, the SARS from before SARS?
Yes, sir. Yes. The name of this virus is SARS-CoV-2.
Wow. Right.
When you get your lab and you get tested for this virus, it says results negative or positive. SARS-CoV-2. Yeah, my dog. So that is something people have to know, which is why I think doctors and nurses were so shocked as to why it was taking so long for them to give the okay for them to wear masks. Because if it's SARS, it's respiratory, which means if you cough, if you spit on me, if you sneeze, if you talk, right. So if me and you are having a conversation within 6 feet of each other, there's going to be some spittle. There's going to be things.
Yeah, we're going to share something.
Right. That's how you can also catch the flu.
Right. Cool. So that's pretty easy then. It's pretty basic.
It's very easy, very standard. I can cough in my hand, touch something, boom.
All right. So now touch something. I'm a big germaphobe. So I'm big on doorknobs in the bathroom with my pinky, and I'm big on my elbow. I was like this before this. So how long would it stay on a doorknob and the surface like that?
Okay, so that is, it varies because another thing you have to remember is there are several versions of the flu. There's H5N1, H1N1, there are several versions of the flu. For COVID, they don't have a Nothing they have is concrete. I'm not going to tell you that they have anything concrete. Nothing they have is concrete, which is why the rules change all the time. So they're saying that it can be on a surface for about 8 hours.
I.e. doorknobs, wood, metals, plastics.
Right. Okay. But if you're working in a hospital in an ICU unit, it can travel on the bottom of your shoes. It can travel on the clothes that you have on because you're in this area. You're in the area. You're being exposed to it constantly, right? Or if you're, again, this is why they say 6 feet. This is why people tell you take your shoes off when you go in their house.
I'm always on that. I never understood personally. I was raised a little different. Like I was raised in a Muslim household, so we never did that, right? But I never understood how you could come into somebody's house after you was on the 2 train, 42nd Street, got off at the junction, stepped in that little nasty puddle at the end of the platform, and then you gonna come in my house and step in my bathroom with your shoes on? Are you crazy?
Right. Because you carry germs on. You carry everything on the bottom of your shoes, and it's crazy because you think. You tell people like, I wash my groceries before I put them away. And they're like, what? You wash your groceries? And I'm like, yeah, I always did it before COVID because of salmonella poisoning. Rat feces gets you sick. Like there are things.
That sticky stuff that be on the shelf when you get it. How about that?
Right. So there are things that you need to do. Like people shouldn't think that, oh my gosh, we're going to be opening soon. Everything's going to be okay. You need to still keep those same precautions constantly in your everyday life.
Right.
Period. Point blank.
Okay. So I don't know. That might have sounded a little scary. We might have took a fast track to some fearfulness, right? So let's switch up a little bit. We're going to get back to that because all this kind of intertwines. If you guys are just joining, I'm with Miss Fee here. We talking. We're just talking as a community about things, some facts, some myths, some things that can make us better. Let's talk about prevention for a minute. That might lighten the mood of this conversation right now.
So the best way right now that is documented is for you to wash your hands. But here's the thing, right? If you have been quarantined, if you're self-quarantining, if you are unemployed quarantining, or whatever the case may be, you must still go outside.
Thank you.
You will kill your immunity.
Thank you.
Your immune system will suffer. You have to still expose yourself to germs, or else when everyone is outside and you get exposed to them, you will get sick. And you will think you have COVID.
Right. So it kind of, all right. I was trying to go back this way, but you got me back this way now. So now, I'm glad you said that. Because we as kids, we play on the ground, we touch things, we build up our immune system. Like Tiz said, you need vitamin D from the sun.
Right, you need the sun.
Wearing a mask and breathing in your own air is not good. Cool. So now, you say it could travel with the shoes, it could travel with the doorknob. When it comes to a vaccination, don't they give you the H1 and the H1 this, and they give it to you a little bit so that you become immune to it? So wouldn't that make sense to kind of touch a little bit, if that sounds crazy, just for argument's sake?
It makes sense, which is why I'm a firm believer that you should get the nasal test, which is they stick the thing up your nose, for COVID, and get the blood test because you want to know if you already have the antibodies.
See, I got questions for days here. Listen, all right. So yeah, because this is great. So this might be a myth. I was going to save this when we do facts versus myths, but this might be a myth. A lot of people are saying, or reading that the test is actually not accurate, and a lot of places are saying that the test actually, if you get tested, you're coming out with it. Like there's very little people that's getting tested and not coming out with it. So
let me tell you the problem with that if these facilities are not testing their employees, are not making sure their employees are trained on how to properly do the test, you will get a false positive or a false negative.
Exactly.
It is possible.
Explain what a false positive and negative is.
Basically, what that means is a false negative would mean that they did your test, but they did not go far enough into the nasal passage to get what they needed for you to test positive if you actually have it. They didn't get enough sample. So you will test negative.
But it's a false negative because, hold up, you keep pointing up here. Are they sticking it up? Does your nasal cavity go up here? I thought it goes back here.
It goes back into, like, back here. So this is your sinus, right? They're trying to get through your nasal cavity at the tip of your sinus.
Whoa. And that's going to tell
they're trying to get into it's like they're going in your brain and scrambling it, because they got to spin it around a little bit. And they have to spin it. And they have to go through both nostrils. So they have to go up, spin, come out, up, spin, and then that's the sample.
Whoa. All right.
So if they don't get enough, you will come out as a negative, and we'll say, my God, you have all these symptoms. How are you negative? Then we'll do the blood test and say, oh, based on your blood test, you have immunity. So that means you had the virus at some point. Maybe they didn't test you properly, and this is why you came up negative, but you were exposed. You had the virus. So that's why I think people should do both. Yes, pals, the Sears parking lot is empty. Nobody's testing. The Sears parking lot over there on Bedford, nobody is going to it. That's Flatbush, people. Let's get involved. Get involved. Go get tested. And the city MD over there and the urgent care over there off of Flatbush, she's doing testing. Get the test done.
Wow. We're gonna drop that. We're gonna drop that info again before it's over. Yeah. But so are they doing the blood and the sinus test? So
the Sears parking lot is just doing the nasal pharyngeal test, but City MD is doing both. They're testing you first through the nose, and then after you get the results, they tell you if you're positive, they tell you to quarantine for 14 days, and then they have you come back to do the blood work to see if your body is reacting and building immunity.
So they have you come back, get in the Uber or a train or a bus or accessoride and sheesh and peace. Yo, yeah. My blood pressure is going up. I just want to let you know that. Like, because somebody just said in the comments, F that test or whatever, right? Because I guess the sentiment with a lot of people is just like, I guess that's why it's good to talk to you, because you're not the government. You're not somebody that's, some type of agent or something. You know what I mean?
Right. Yeah. right.
So, sis, look at me. Should we should go take this test? The test is not going to give it to us?
No, like I said, remember I said I had 6 employees, 6 nurses, 5 quarantined at home. Of 5, 2 were negative. 3 were positive. So if you're testing positive, it's because you have it. Now, if you don't want to go to a hospital or or one of the testing sites, which is probably why Church Avenue in Bedford is empty in the middle of Flatbush, then go to the urgent care. Go to Big Apple Urgent Care. That's Black owned. That's one of our own.
But I mean, it's one of our own, but and I'm not, listen, I'm asking you this, but I'm not debating with you. I'm definitely not. I'm just speaking. I don't want you to think I'm, with you.
I don't. We having a discussion.
I guess my thinking is like, if the test comes from China, or if the test comes from some G17 government facility in Arizona, even though it's a Black-owned facility, you know what I'm saying? You're saying it's accurate. You guys are testing. Is it getting sent away? Is it getting tested on the site? Like, what's going on?
So everybody uses a different lab company. So our tests, we're not doing the instant test. The instant test comes from other places. That is correct. Those people who are doing the test, there's a difference between the tests. So the nasal pharyngeal test, you could either do it through Quest Diagnostics or LabCorp, right? And the blood work can be done, again, through Quest Diagnostics or LabCorp. That is strictly in the United States of America.
I got you.
But the SNAP test, or they're coming from everywhere. There's different places that are giving that have been creating that test. My company does not trust the SNAP test, so they are doing it the old-fashioned way, nasal, blood work, Quest Diagnostics.
Okay, so they did a test. Oh yeah, somebody said they talk in the comments. They're talking about the goat in Africa.
Yeah,
there was a
the pawpaw.
And a pawpaw. He tested it. You're laughing. You laughing because that's not true?
No, I don't know if it's true because
okay.
I didn't see it reported in the news.
I don't know.
I saw it on Instagram.
Instagram.
No, I saw it on Instagram, so I don't know if it was true or not.
Right.
But don't get me wrong. Like I've definitely worked. Like I said, I was in animal medicine, and they started doing like DNA kits for pets, and it cost $500. And we were like, you know what? Let's see what this is. And we tested ourselves, and I came back as a Labrador Retriever. My doctor came back as a pit bull. So.
All right.
I'm not saying.
Definitely. Well, I like that. I mean, like we said at the beginning, you're giving your experience. You know, you're not speaking
right.
from this, you know, this is just your personal testimony. Okay, let's spin back a little bit to back to prevention. What do you feel about, I have a West Indian background. A lot of people from Flatbush have West Indian. Where are you from? Jamaica and Guyana. Oh man, your immune system is rock solid from Jamaica and Guyana. What? So look, now, what about all the sea moss and the ginger steam with the lemons and is all of that effective prevention? So I'm, again, I'm not a medical professional. But, you know, a lot of people's bodies are built differently, right? Mm-hmm. So maybe for you can overcome this without medication, right? Some people can use, especially if your body is already used to it, right? That's fair. So if you've already been doing echinacea and black seed oil and moss, my cousin is ITAL, straight ITAL. He gets moss by the gallons. His family does not take medications. When they get sick, when they feeling sick or whatever, they do moss, they do Irish moss, they do all that stuff. It works for him, but it may not work for me because I'm asthmatic, right? So if I get a respiratory disease, I cannot take moss. I have to take albuterol. Right. So I'm not gonna say that the home remedies my mother gave me didn't keep me healthy. I'm not going to say that when I speak to my mom or my cousin and he says, listen, mix this and this and this, I don't feel better, right? But I don't want to give people a false narrative and say, yeah, man, if you do that, it worked because it worked for me. Well, it may not work for you. Well, you're right, though, because people hear it now and they jump on it. But, you know, for the last 10 years, they've been eating ham sandwiches and drinking Pepsi and, you know, and now you ITAL. Exactly. Now they want to jump, and it's maybe a little too late for that, at least. I think vitamin C, I would still promote people. Very important. Listen, at the end of the day, like I said before, you still need to go outside and get the sun. You still need to take in your vitamin C, your zinc, your magnesium. You should be taking vitamins every day. Period, point blank, because we're all older. I'm 37 years old. Yeah. I am not creating the things that my body needs on its own anymore. Yes. It needs help. And that's real talk right there. That's real talk right there, because we have to know our bodies, people. Not to even go off of COVID for a second, but what you just said is key. We start bone marrow. We start producing at a certain point. You know, we start doing different things. So to be in tune with our body is a very, very key prevention. Very key. Internet is going crazy. Right. So you're right. Yeah, nah, you good. What's your thoughts on vaccines in general? I heard you say earlier that the flu was, that I forgot about that. See, I never got a flu shot in my life, so I know, but you said that earlier about the H14 and the whatever. Do they shooting you with all that to keep you in it, right? Am I correct? That thing is freezing.
Yeah, I was freezing too. Sorry about that, y'all.
You good.
But I'm on edge about vaccines. Very edge about vaccines. So that's a dangerous time here, right? Right. Manny McFly 617. Yeah. Manny McFly 617 is correct. COVID isn't everything. You have to remember that. COVID is a cold. Period. Right, pals? They hear the word vaccine. Face, exactly. Vaccine talk is dangerous talk. No lie. Right? It is. Right? Because
but it's dangerous because it's necessary. And necessary talk, people try to suppress. And we're not suppressing that in Flatbush.
Right. So the first time I ever had the flu vaccine, I thought I was going to lose my life. I got so sick. Yeah, pals, my Wi-Fi is acting up. I got so sick. And I was like, I'll never take this again. And I got away with not taking it since 96 until recently when I got back into this new job. I had to take the flu shot because I didn't have a medical reason why I could not take it. Now, I did not get sick. I didn't feel any way whatsoever. But let me tell you something. I would not take that corona vaccine. I would not.
You're not doing it?
No.
Do you have a viable plan? We're gonna need each other for this, all of us, because for the people that's not taking it, we gotta survive. Right. And everybody that knows me knows I can talk survival all night, so I ain't gonna start with the survival. But do you think what you gonna do? What can we do?
I feel like as long as my body has developed immunity to it, then this is why, again, I'm pushing the blood, getting the antibody testing. Because if my body has built up immunity to it, I work in the medical field. You can't tell me I haven't been exposed. There's no way.
Oh,
there's absolutely no way that I have not been exposed. So I more than likely was already exposed. My body went through it already. Maybe I had a tickle in my throat. I may not have had strong symptoms to it, right? But there's no way I believe that I have not been exposed. So why not get the blood work, keep it for my life, and say, look, I have immunity to this. I am not going to be your experiment.
So we was talking about that a minute ago when we spun back. So let's get back to that. Once you have it and you test, no false negative, no false positive, you either true positive or you had it, you good now then, right? You can't get it. It's like the chicken pox. You can't get it again.
No, it's a virus. So cannot tell you that you cannot get it again, right? They can only tell you that the chances of you getting again is minimum, right? But there is no proof that you cannot. Because then, if that was the case, the cold, we would never get a cold again because we got it already. Remember what I said a few minutes ago? Right. Corona is the cold. Right. It's just an evolved. Coronavirus is a cold. Yeah. And then it just developed into SARS and SARS-CoV-2, and you understand what I'm saying? Yeah. It mutated into these other things.
Jeez and peace. So,
yeah, Sharon, I did say that they can't tell you that you can. You will. It's a possibility that you will get it again, even though you did the antigen testing. Yes, Sharon, I did. I definitely got on that.
So,
and somebody else said, almost woke, said it stays in you for almost 30 plus days. That is correct. We have had a patient who kept testing positive after 40 days. But they did not, when we did their blood test, okay. I got to get a little scientific right now.
Yeah, get it.
So everybody Listen to me very, 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 very closely. The antibody testing is two different versions of the test. When you go to CityMD and all that stuff, they are doing IgG antibody testing. Uppercase I, lowercase g, uppercase G. I don't know what the acronym stands for. But they're doing IgG testing. That is basically memory antibodies. What that means is it tells you that you have been exposed and your body has developed antibodies to fight it if they see it again. Right? Then you have IgM testing. That is testing to see if you have active antibodies, which means you currently have COVID and your body is trying to fight it. Those are the two different versions. Right now, everybody's doing IgG, not IgM.
So the IgG is the one, that's the first one. That's the memory antibodies.
That's the memory. That's the easiest way to remember it. IgG is the memory. That means your body said, man, I recognize this. We're going to hold this in the back right here. I know what this is the memory of it.
Oh my gosh. All right. So we touched on that. All right. Let's go to a little bit of facts and myths.
Right.
A little bit, right?
Right.
Some of the facts that we know is sneezing, right?
Mm-hmm.
That's fair.
Mm-hmm.
Coughing,
mm-hmm.
That's pretty fair, right?
Yep.
Yep. Let's go with some of the myths now. I guess handshakes and daps. What about daps? I know brothers is on this dap. You coughed in your hand, you give a dap, you finished with. You need an IgG. You need a what's the other test? Not the IgG test. You need the other test.
You need the IgM.
You need the IgM test for that. Brothers out here dapping it up after coughing.
Right. And people do that. People do that. Now, everybody got to second guess a couple of things. Those who be sharing blunts.
I was about to ask you, what about this? Yo, big man not supposed to be sharing spliffs anyway. But if you got to share your spliff, like just that little bit of saliva right here, just right like that, boom.
It is droplets. That's right. Sound. Oh, it is droplets. That's right. That saliva will spread. Yes, it will happen.
Jeez,
so
jeez.
as long as you cannot say that this person that you're about to open palm touch
I ain't open
did
palm,
not
nothing.
just cough and sneeze into their hand.
Nah. Yo, listen, open palm.
And you got to remember, it's more than COVID. You understand what I'm saying? There's so many things that you can pass other than COVID.
It's heebie-jeebies. It's cooties. It's all kind of stuff out there. But look, so here. Oh, so what about the elbows? I know brothers been elbowing it up.
Yeah, that again.
But you said it sits on the shirt though. Like, what it goes?
Right.
Can it go through the shirt?
No, but when I said it was on the clothes, I said you have to be in an extreme situation, and I said that because there were news reports that were saying that it can be on your clothes, it can be on here. The study that they got that information from was done in an ICU COVID unit.
Got you.
Which is why I'm sure a lot of you guys saw that, like the New York Post, our wonderful New York Post said, hey, that you can carry it on your clothes up to 18 hours and all of this stuff. It was based on a study that was done in an ICU, a severe ICU unit. So you giving elbows. At the end of the day, if you're gonna salute, gesture to anybody,
you should
right. Use some hand wipes, hand sanitizer. If you can't wash your hands, use some hand sanitizer.
Man, dude, a lot of people was in the streets. Everybody talking about how they outside. Everybody's outside. So now it's time for the lion paw. Let's just implement the lion paw in life, fellas. I see some people in the comments saying some things. Kenya, he asked about the steaming. Bro, we spoke about the steaming. She was saying that it works. It's definitely a bronchial thing. However,
Yep.
to keep the narrative, in context, that if you've been doing it, it probably will work. If you implement it, it probably will work down the line. But if you just like jump up off of an unhealthy lifestyle with a lot of underlying health issues, it probably won't work.
Exactly.
Let me see. Somebody said head nods work too. I saw something else real quick.
Head nods do work.
Head nods work. He said steaming. It was somebody else. Oh yeah. Manny McFly. We did touch on that too, bro. She was talked about bacteria, and she said bacteria is necessary, but that's, I'm assuming, basic bacteria, the regular.
Right. Not no salmonella.
Not no SARS, COVID. Somebody said
Manny, but you're right. Even the people in charge don't know, because Manny, everything keeps changing. Everything keeps changing. It's not just that the people who are in charge of you telling you things don't know what they want or don't know what they're talking about. It's because above us, it keeps changing. The CDC changes something. You get alerts from the CDC all the time. All the time. It's so horrible. It's really tough. It's really tough. It makes you look stupid.
Well, how helpful is this, you think? Like, is it good for us to talk as a community? Because we can't
think it's good for us to get the opinions of people who are able to listen to what people are saying and answer their questions with facts. Which is why if I don't know something, I'm not going to say I do.
Okay.
You know what I mean? But the internet is so full of information. Yeah, this is why I always tell people, you have to do your research. Like, I'm not going to look at a picture and say, oh my God, that has to be real because it's on the internet. You have to know where the information, like, I need to have a credible news source telling me that that is what happened in order for me to believe it.
Copy. Yo, before I even go to the next thing, I just want to say I salute you and I appreciate you. You know what I mean? Again, I can't say that. I can't say that enough. So now, where was I going now? All right, we was gonna go to this at the beginning, but I kind of wanted to not go there just yet and go into some preventive measures. So let's talk about the steps one should take before coming. You felt the tickle in your throat. You felt like you smoked a blunt with somebody that looks a little shaky. Whatever it is, at what point is it, I got to call Fee, I need a test, I got to go to Sears, I need a test?
So I think, okay, so here's the thing. I think, my personal opinion, I think if you have one symptom, you should be tested. But unfortunately, this is not how this works. They are only testing you if you have up to 3 symptoms. And FYI, they changed the symptoms, guys. They just added nausea, vomiting, and diarrhea. And they removed headache, which I think is ridiculous because a lot of people have had headaches and they had corona. So I'm a little annoyed that they removed headache as a symptom. And I'm mad that they added those 3 symptoms because that is a symptom for freaking, I got off a roller coaster.
Exactly.
You understand?
But, and not to mention, somebody just spelled said, what about allergy season? Like, I live in an area where my allergies run bananas. Right.
So, here's the thing too. So one of my employees who, all alcoholics have those symptoms. Exactly.
That's a fact.
But one of my employees, the doctor was like, this isn't corona. She has, loss of smell and taste are symptoms as well. She has a sinus infection, and this person has chronic sinus infections. I also have chronic sinusitis. She ended up having corona.
Hey, did she have it or was it a false positive?
No, she had it. My doctor, at that time, my doctor was doing the test. It wasn't the nurses. The doctor was doing the test, and she had corona. We all thought it was a sinus infection.
Is she okay?
She's fine. She's fine, back to work. But the thing is, this is why I don't believe you should have 3 symptoms in order to be tested. They're not, and then you can't go to an urgent care and get tested if you have symptoms, people. That's another thing. Urgent care will not test you if you have any symptoms.
Only the
Only
designated spots,
asymptomatic.
but only the
Only the
spots.
designated
Right.
testing spots.
Wow.
Only the designated testing spots. So if you lie to them and say, I don't have any symptoms, but they check and you have a fever, they'll probably test you because you're already there. Or if you come to my center and you have a fever, we won't even see you. That's because we've had so many staff test positive. We don't, because there's not enough PPE.
Oh, I was going to ask you earlier how was your PPE situation looking?
So we had to source our PPE from another company. I swear to God, I think it's from China. Because the masks are just horrible. The masks are horrible. Anybody who follows me on Feed Chronicles every morning, they see my Bane mask that I wear on the street. Because the surgical mask, the other thing that we have to factor into, we're wearing these masks, right, to protect ourselves. What are they made out of?
Paper, cotton, the thinnest cotton.
Right. But what is keeping them treated? Because they have a sheen or something over them. So
like
they have some
waxy
sort of
something, right?
Right. So that, for me, when I wear those masks, the surgical mask, it actually makes me sick. It makes me cough horribly. So I have to wear like an N95 mask and then put the surgical mask over it. But the N95 is too good because I'm an asthmatic. It's hard for me to breathe. So I wear an N100 mask. I can actually show them to you. Let me get them.
Yeah.
I'll show them to you.
Yeah. What up, y'all? Tiz, I got you. I'm going to ask her in a minute, man. This is crazy, y'all. Like, jeez. I got allergies. So every time I sniffle, I want to stick my finger in my ear. I'm like, is this a symptom? Sheesh, you can hear me? I thought she wasn't there. But I think we're going to be all right, though.
So this is a regular surgical mask. This is what my company has given us. Now, if I put it on like this, it's too big, right? So I have to wrap it around twice so it could fit me.
Hey, shut up.
And then you see people put the mask on wrong. They have it on upside down.
Yo.
The mask.
How you feel with your glasses? Yo, glasses is the worst.
Yeah, I have to take my glasses off because then I can't.
Glasses off. I
have to take them off. So then I have this broken N95.
How old is it? How old is it?
Probably.
How long have you been wearing it?
I've been wearing this for like 3 weeks for the train.
So oh, I didn't even get on the train yet. Hold on, we gotta touch on that. That's an N95.
So this is the N95, right? And then this is what I wear on the train.
Yo, I have that mask. Where'd you get your cartridges from?
The job.
I'm gonna DM you. We're gonna have to talk about that offline.
So this is what I wear on the train, but I usually change like when I finish doing my Feed Chronicles because I can't talk in it. It's no one can hear me.
Nah, you're supposed to be talking. If they can hear you, they too close anyway.
Right.
Somebody asked, Tiz had asked if how'd your coworker beat it so that we can know how some people are beating it.
Okay, so several coworkers. Now, the one who we thought had a sinus infection, she strictly had to use medication. But no offense, she was the pink people.
Mm-hmm.
And then my other coworker, he couldn't get the fever down with like ginger tea or anything, so he had to take Tylenol. Somebody else almost woke. They did the onion. They did boiled red onion, and they did steam with orange rinds and ginger. They did that a lot while they were home. And another thing, they exercised.
Exercise is key. Oxygen to the body.
They exercised. The ones who were moving, exercising, getting their bodies going, they recovered much faster. My pink person, She was down. She was sleeping for hours upon hours upon hours. She was not getting up. She wasn't budging. She wasn't moving. So it took her more than 2 weeks to recover. But the other employees, you know, our folks, they were exercising, they were moving, they were getting their vitamin D, they were, you know, doing their home remedies. But these are people who, oh, I burn sage, I drink moss tea, I do. They were already doing these things.
Like, what are they talking about? Sage is for spirits. It's not the boogeyman.
No. Some people burn sage to like kill germs and stuff like that.
Oh, the black sage, the white sage, right. Got you.
Yes.
No
So
disrespect to the Italian.
those people use natural things for them. You know what I mean? And like Miss YDL said, you can't lay down. It's a respiratory thing. You can't stop moving.
Yeah.
You can't.
Yeah, now this is, I feel like, you know, this could be a wake-up call. I think we've survived worse, so this could be like a wake-up call where, you know, people are more conscious about what they're doing with their bodies, hopefully. You know, I know,
right.
You know, me and my guys, we've been exercising, finding parks and hitting places of scarcity. My man even built, big up the tears, he even built the whole thing in his backyard to exercise. So, you know, these things are possible.
Right. So there's things that you can do. There's things that you can do. And you have to listen to what some people are saying on the internet. Like, people are on the train, their mask is upside. Today, somebody was on the train, his mask is upside down like this. How are you wearing your mask when the thing for your nose is underneath your chin? This doesn't make sense.
I thought, so it can actually, but particles can't come through when it's like that, right?
So this mask is to protect you from me. It does not protect me from anything else. If you are sick, I can still get sick with this mask.
Oh, so those blue masks are for that 6-foot conversation of spit we got to exchange when we don't have it on, basically.
Right.
Okay, so now the N95 mask is more for particles.
If you look at the explanation of a surgical mask, it says it is specifically used to protect you from me when I'm talking to you.
Copy.
But it's not protecting me from you when you're talking to me.
I'm a little confused, but I think I got you. So stuff can't come out, but it can go in, or vice versa. I got you.
Right. Stuff can come in, but it can't come out.
Got you.
Right. This protects you from 95% of everything, which is why it's an N95.
Oh, that's because why it's N95?
Yeah. That's why it has the number.
Yo, like we got like 10 minutes left. I'm surprised that wasn't the first thing. That's like one of the biggest jewels. I didn't even know that.
Yeah, and that's why this is called N100, because it blocks everything. And face, no, you do not flip it to the white part to protect you more. That's not true.
Oh my gosh, face, that's on the myth. That's on the myth list. See, let me ask you this then too. That mask that you have, the 3M mask with the purple canisters on it, right?
Yeah.
I have that mask, right? But I don't have the little canisters on it, right? When those canisters are off and that little circle is there exposed, can I rock out? Am I better? Is this like better than nothing, or is it like one of those lamb condom kind of things?
So before we get cut off, these are your filters. This is what's filtering your air, right?
Yeah, I need those.
So if you don't have this on it, you're just sucking in regular air.
I got an N00.
Right. The flaps on the inside open, right? I don't know if anybody can see. Right. So that's straight regular air right here. That's my finger on the other side.
Oh,
there's no protection.
Oh man.
There's no protection.
I haven't been wearing it, but I have it, and I was just
You need the cartridges. And if you're not using it in construction, then the cartridge lasts way longer because there's no particles being caught in the filter.
Yeah, I'm not using it in construction. I'm more so just
You just were lucky enough to get one.
Yo, I think I got the last set, and then I didn't know you needed the filters. So then I ordered the filters, and now the filters are done.
Done.
Yeah, I haven't used it. It's still crispy. I'm not out here, you know. Let me see. So we talked about vaccinations. You know, we covered testing, the IgG and the IgM.
Yep.
Right. One test if you got it and it's popping. One test if you had it and it's dormant. Right.
Right.
Okay.
Right.
We got the testing over at Sears in the parking lot on Bedford.
Right.
You encourage everybody to go there.
I think everybody should get tested. I do. Especially since they're getting the tests, get tested. If you don't trust the test, you should trust the nasal test because at least it's getting done through Quest or LabCorp.
I would think that it would be the other way around. The nasal test, not only is it intrusive, but my thing is like the test in Africa. Let's just say, for argument's sake, it was real, right?
That was a snap test.
Did we cover snap test?
Nobody don't trust it. That's why they're saying it's coming from China and da-da-da. It's the snap test that everybody's talking about. But the nasal pharyngeal test, if it's done correctly, boy, you're going to feel it for a little while.
How long does that take?
2 seconds. It doesn't take long. They literally stick it 6 inches up your nose, swirl it, stick it in the next one, swirl it, and put it in the container, send it off to the lab.
So let me ask you this then. Right, this is just me and you talking right now. If we don't take it as people, right? Because all of us don't take it. Everybody on here, plus the 3,000-4,000 people on We Are Flatbush, nobody takes it. What do we do next? We can't go to work. We can't go to school. You know what I mean? Do we need a community? Do we need to start planning for that? Do you think it's going to get better before it gets worse?
It's getting better. It's getting better. At least in the sense of the amount of people dying. So what people got to realize too, when they see the results on the news and it says 2,000 people are positive for corona and 800 deaths, no, not 800, that's too much, and 100 deaths, the positive cases are rising because we have more tests. So more people are getting tested. So the positive cases are going to rise if people are getting tested and finding out that they're positive.
But it sounds beatable. I mean, I have an aunt that has lupus like for years. She suffers. She went into the hospital and it was just like, oh my gosh, like it was, my heart was heavy. You know, she came out with the thumbs up. Like a week later, it was crazy, masked up and gloved up. Like,
it's beatable, right? It's beatable. So lupus, that's a dangerous sickness to have and have COVID, because if you're having a flare-up and you have COVID, the case may be different, right? So it's a matter of how prepared is your body. When you go around people and they get sick, are you that person who says, man, get away from me, because if you're sick, I'm gonna get sick? Yeah,
I know those people, right? Too. I know.
Right. And there are people, you sneeze on them, you don't even have a cold, it's just an allergy. And the next time you see them, their eyes is running, they dying, they deathly sick. Those are the people who should be concerned. Because your immune system is shot.
That is so real right there. I'm glad. Those are the people right now that need to start their steams, start their vitamin C regimen, start the sea moss regimen, find out, like Papa said, man, I'm so glad we had this conversation. I want you to, we got a couple of minutes, but I don't want to feel rushed. I want you to give the people your Instagram if you want to. Okay. You know, whatever you want to say to the people. Our stage is your stage.
Thank you. So my name is Pheona Grant. My Instagram is at @PHE_easy. And you know, I do Fee Chronicles every day.
What is that?
My commute. That is my commute to work.
I got you.
I basically talk about what's going on the train, the difference between MTA and New Jersey Transit, because nobody's on New Jersey Transit. Everybody's
I used to live in Jersey, and that was my commute every day, New Jersey Transit to Brick Church Station.
Nobody's on there. And I also am the vice president of the Slim Heart campaign. And that is a non-for-profit that I do with my friends. And this year we had to cancel our shoe drive, but every year we collect shoes for high school children for prom, boys and girls.
That's dope.
And we donate them to prom drives. This year was supposed to be April 26th, but because of COVID, it was canceled. So everyone hold your shoes. I appreciate it, but we've been doing it this would have been the 9th year. But we've been doing it for years. Like, we got a proclamation for it. We've done it in Brownsville. We've gone to the Bronx. We've gone to Staten Island. Everywhere. We got shoes from Georgia, DC.
Somebody said, you said Georgia. Let me try to get both of these in. Somebody said the second wave is going to come when they let everybody out with a lower immune system. We kind of touched on that. That's why she was like, everybody go outside, get as much sun as possible, fresh air, breathe deep, have positive thoughts, good vibrations. Think of a plan. I'm always big on that. You know what I mean? Think of a plan.
Yes. You got to get your immune system up, people, because it's true. The second wave is basically the people whose immune system died because you didn't go anywhere.
Yeah, exactly. And that's
it.
And that's important. I mean, I think we're looking good, people. I mean, we've been through worse, right?
Right. It's true.
Yeah.
I mean, all our medical professionals survived HIV. How many people was working in the hospitals and these people are coming in and they didn't even know they had AIDS and they survived. So we can too.
Yeah, we're going to do some survival. We're going to do some survival. Unless somebody starts to give some survival tips. They know I'll be out here in these crazy areas, all kind of stuff. I'm always on that survival stuff all the time. It's my whole thing. But another thing, what about the people that's out of state? Like you said, Georgia earlier. We got people that check in from all over. Is it the distance from proximity to other people? Yeah, we got a minute left. Sheesh. Do you think that's better or worse? Like, you think that that's more helpful, conducive?
To distance from everybody?
Yeah, like how the distance is out of state. Everybody's in their car. You go to the store. You don't touch the door. Walmart opens up.
Yes, it's true. We are a cluster of people in New York.
Yes.
So it's inevitable that it would spread quickly.
Yes. Damn. Fee, I appreciate you, Fee, man. Everybody's checking in. Everybody's saying you did a phenomenal job. This is a great convo. People caught the end. Check it out on IGTV. I mean, we got everybody. YouTube, check out our YouTube page. We got everybody from Flatbush coming up in the past. We got a lot going on, and we're grateful for everybody. We're grateful for you. We appreciate what you're doing on the front lines. We appreciate your staff, your team, like just everything. Like, much obliged, for real. Seriously, from my heart. You know what I mean?
Thank you, everybody. Stay safe.
Yes. Yo, peace, beloveds. I thank everybody for rocking with us, man. Check the YouTube. Prince, what up? Pop, what up? Face, what up? Fat Boy,
welcome, everybody.
Later.
Thanks, Sissy.
Later, y'all. It's the first time they didn't cut me off.